I wish to acknowledge the Ngunnawal people as traditional custodians of the land we're meeting on and recognise any other people or families with connection to the lands of the ACT and region. I wish to acknowledge and respect their continuing culture and the contribution they make to the life of this city and this region. I'd also like to acknowledge and welcome other Aboriginal and Torres Strait Islander people who are listening today. Welcome to Safety Spotlight, WorkSafe ACT's podcast series that takes a good long look at health and safety issues shaping the modern workplace. I'm your host, Lish Fejer, and today we're going to look at a risk you can't really see, you can't visually eyeball. They're called psychosocial risks, and whether you work in this space as a safety professional or you want to know how to keep your staff and yourself healthy and safe, this is really essential listening as to what organisations can do to create a psychologically safe workplace and understanding what it is and how to mitigate it. Joining us at the microphones is Professor Maureen Dollard, an Australian Research Council Kathleen Fitzpatrick Laureate Fellow and Director of the Psychosocial Safety Climate Global Observatory at the University of South Australia. Her research has identified the corporate climate for worker psychosocial, psychological health, corporate values, systems, processes that are really crucial to understand the mental health crisis and work engagement and how they are so linked. And my regular, I'd like to say co-host, Jacqueline Agius, Work Health and Safety Commissioner and Labour Hire Licence Commissioner here in the ACT. She oversees workplace health and safety in the ACT, ensuring compliance, but also she's a PCBU, so she has to practice what she preaches as well. Hello to you both.
Great to be with you, Lish. I've been called many things in my life, but never a co-host.
Well, I think you are now. And Maureen, welcome.
Thank you.
We might kick it off with you, Maureen.
Yeah.
Psychosocial risks.
Yes.
It's not a slip, trip and fall hazard. This is something that seems new in our vocabulary of health and safety in the workplace. What is it?
Yes, it does. So psychosocial is, it seems like a complicated word, but really what it means is it refers to social factors in the work environment that have psychological consequences. So these social factors are by human design. Somebody decides to design a job in a certain way, allocates a certain amount of resources, might make the work, enjoyable but quite demanding. So these are all these like human choices. So these are psychosocial factors, and some of them are risky to your psychological health and well-being. So these psychosocial risks are factors in the workplace that can be damaging to workers' psychological health and well-being. And so to be psychosocially safe means that you are working in an environment which is free from these psychosocial risk factors.
You've worked in this for a long time, and Jacqui, I'll let you jump in, Jacqui. What do you want to add?
Oh, look, I was just going to say, and hi, Maureen, it's great to have you with us.
Thank you.
I just want to pick out one thing of that, and that is you linking the psychosocial hazard to the work environment. One of the things that we hear that really challenges PCBUs is thinking that when we're talking about psychosocial hazards, that we're talking about causing a psychological injury that is related to a person's personal life or home life. And I think it's really important just in this podcast to link what we're talking about here is a psychosocial hazard that is related to the workplace.
Yeah.
So that is what we're trying to control here. The other part of being psychologically unwell is important for PCBUs to consider, but it's not necessarily under the work health and safety legislation. It's more related to human resources.
Because people can bring their own mental health from their personal life into the workplace.
Most definitely.
How do you distinguish that line when it gets into the workplace? This is the quagmire of psychosocial risks and managing them in the workplace, isn't it?
Yeah, so this is a very good question, and, it's very interesting to think, where does the psychological issue arise? And when people might be exposed to stressful work environments and then shift to another work environment and still carry the legacy of exposure. So where it begins is difficult to know exactly. Definitely outside factors could influence how people can manage and cope. And certainly we see at certain ages, people are better prepared to cope with the demands of the work environment. So there are a lot of interacting factors, but there is definitely a huge amount of evidence which shows that the exposure to psychosocial risks at work is related to psychological injury and a lot of other health outcomes as well.
I think also it's partly what we know. So what do we know now are the hazards, the psychosocial hazards in the workplace, and there are some really common ones. And so they're the ones that we focus on reducing or eliminating the risk to, and they're things like job demands, low job control, poor support, lack of role clarity, poor organisational change. And, there are others that we are aware of. So we start always, when we're trying to control these hazards, with the ones that we know exist. And there's a lot of research on those.
Why is psychosocial safety just as critical as physical safety?
I mean, health is a holistic thing, so it's comprised of physical and psychological components. So if somebody's psychologically unwell, they are not able to perform their job tasks. If someone's got a broken leg, they probably can't either. So it affects, functioning, cognitive functioning, how you operate at work, etc. So yeah, of course, it's as important as physical health. And we're so lucky, really, in Australia that we've had new regulatory frameworks that enable us to actually acknowledge psychological health as a work health and safety factor that we need to protect.
We want to get onto those frameworks, Jacqui, because I know that's such a big part of it.
And just if I can add to that, because I would go as far to say that in some instances it's even more important than physical hazards. And the reason that I say that is because we know from workers' compensation data that the median cost of a serious mental stress claim is nearly $67,500. But when it comes to a physical claim, the median cost is $14,500. The impact of a psychological injury can be far greater on the person and far greater on the impact of the PCBU, because it often takes a person to get back to work a lot longer. It impacts on their entire relationships within their families and their communities, and sometimes people who obtain a psychological injury from the workplace never get back to work. And so a psychological injury can be both psychological and physical. And so we've even got a greater need in our country to ensure that we're managing these risks.
Research has shown that people will take, long service leave or all of their sick leave to try and cope with the psychological reaction to the workplace, because there has been in the past so much stigma attached to worker mental health. And so what happens is, by the time that they really do need to leave work or take a long absence, or even put in a workers' compensation claim, things are pretty bad. So it just reminds us as well that we need to, look at, early intervention, a psychosocial risk assessment, so that we can prevent and we become aware of the psychological status of our workforce before it becomes, something that they might not be able to recover from.
Because the stigma is still huge with both disclosing mental health and your own psychological struggles
Absolutely.
in the workplace, as opposed to physical issues. It's quite easy to disclose those, and it's interesting you say that people take all other options before.
Oftentimes, yes.
They mightn't even go down the workers' compensation path because their mind just hasn't got the strength to do that. I want to explore both your research, Maureen, and also from a I guess, an identifying the risks, how you go in as an authority on this and go and inspect, and then how businesses can comply. You mentioned stigma.
Yeah.
That's a tricky one to overcome.
Yeah, it is. And actually what we discover is our research focuses on the safety system of the organisation and the safety system for worker psychological health and wellbeing. So we've been talking about psychosocial risks, but we ask the question, where do they come from? So if you go a little bit further up the tree, you think about things in any safety system that you need. You need top management commitment and support for the protection of worker, in this case, psychological health and wellbeing. You need management to prioritise worker psychological health versus all these productivity imperatives. You just can't drive humans beyond their natural limits. And we need, good communication systems and also the participation of all stakeholders in trying to, assess the risk, control the risks and so on. So you've got a whole system that if this is working really well, not only can you prevent future risk, but our research also shows that the stigma is much less in these kinds of organisations that have a high psychosocial safety climate with all of those elements that I just described. So if there is good recognition of psychological health, workers know there might be risks and how we can work together to control them. But knowing about the psychosocial safety climate, we can also understand that workers have less stigma. There is less stigma.
Let's look at a workplace that is absolute best practice in this.
That could be WorkSafe ACT.
But I think that's a great place to start, because when you look at those key factors, Jacqui, you highlighted some of them earlier, that make a psychologically safe workplace, and then you, Maureen, look at it from this sort of the high psychosocial climate and what is great. You have an observatory, a climate observatory for this stuff. What is best practice?
Best practice is just actually enacting any of those things. So, just assess the risk and control the risk, eliminate the risks. That's what we have to do. But to do that in an effective way, in a sustainable way, we need a strong psychosocial safety climate, which is all of those elements that I described before, like top management commitment and support.
On the ground, if I'm going into an office or a construction site, what does that look like for me as an employee?
Yeah, I'm sort of wondering if you could take photographs of workers before and after and have a look at their faces and see what the level of stress is in that organisation. But you would see, you probably see some value statements around saying, our organisation values our workers' psychological health and wellbeing, and we talked about it about occupational violence and how to sort of value the worker in this. And even in sort of managing the workloads, if we can sort of step in and resist new workload coming without giving up some other tasks that we've been asked to do. So what does it look like? I think people are happy. There's a lot of trust. You might see the senior management walking around talking to workers at the coalface.
Is there a correlation between sick days and psychosocial health of the workplace?
Yes, yeah, absolutely. Our evidence shows, in good research, which is you measure the psychosocial safety climate first, and then you watch what happens to workers over the next 12 months. And, you can see sickness absence rates definitely correlated. There was a study across the Australian Public Service and showed the psychosocial safety climate across government agencies was definitely correlated with sickness absence. So this links into the productivity issue. And we can definitely see that in an organisation, for example, we did this, it was a private company that was actually doing really well. Their psychosocial safety climate scores were, over 41, so it was really going well. But even in this organisation that's going really well, you could actually save like $5 million by bringing everyone into the green and therefore reducing the sickness absence of all the people, because there's a correlation, right? If you shift everyone up, you reduce that rate. And also turnover is even like a much greater dollar value if you can reduce turnover. So together, those things of a company doing quite well, 5,000 workers, you could save $5 million in 1 year if you increase the psychosocial safety climate.
So Jacqui, as a PCBU, what do you do to ensure it? What does it look like on the ground for you and your employees?
Yeah, and you mentioned earlier, Lish, about what do our inspectors look for, and I'd just like to address that for a minute. So when our inspectors go out and they're looking at whether or not an agency or a business have adequate controls and in place for addressing psychosocial hazards. What they're looking at is the safe system of work in place. So they're assessing that safe system of work, and then they're determining whether or not there are any additional things that a person needs to do. And often PCBUs, if you ask them what's your safe system of work, it's really hard for them to be able to say that. They just find that a really strange question. And so for me as a PCBU, it's really important that I can identify all of the elements of our safe system of work, because often people think a safe system of work in relation to psychosocial hazards is having a complaint process and being for people to be able to advise risks. But if they're not implementing or doing anything when somebody makes a complaint, that won't be a safe system of work. So our safe system of work looks like this. Overriding everything, we have a risk register. And then I would put our the categories sitting under that as people, risk assessments, and then consultation. And for us, that looks like, for people, we have clear position descriptions, we have a performance development plan, we have our standard operating procedures, which are our directions to our staff on how to carry out their duties. We have a complaints process. We then, on top of the complaints process, have conduct processes, training, supervision and support. So I put all of those things under people. And then under risk management process that we have, and we've talked about it many times, and I'm sure, Lish, if I asked you, you could absolutely just say what those 4 things are.
I know it starts with identify.
Oh, fantastic. Yes, it is. Identify, assess, control, review. And then the third part being the consultation, which we have our HSRs and our deputy HSRs, our work groups, our safety committee, and then that all is managed up to our senior leadership team. And backing all of that up, we have our policies and procedures. That's how I would describe WorkSafe's safe system of work.
Across both physical and psychological risks.
Yes.
So you know what you're doing.
Yeah. I mean,
more into most places?
That sounds, perfect. And I think a lot of workplaces would have these arrangements in place. You know, by law, there should be a WorkSafe committee, HSRs, etc., in larger organisations. And I think, like on paper, the policies and procedures, can look marvellous. I've seen some cracking policies, that go on for pages, but whether or not they absolutely get enacted, whether or not people are brave enough to use the risk register, if anything happens once you put something into the risk register and you don't risk losing your job, there are all of these issues that ordinary workers face when they are, in a situation exposed to a psychosocial risk. So I think, the idea of the psychosocial safety climate would be to exercise all of this and make sure that it's all working, that the HSRs would be a really crucial component in this. You've got a more human element at the front line that can also feed up information into the system. So it's got the fundamentals definitely, but we need to see that it actually works from the perspective of the employees.
Let's take it from the paper to actual real case studies. What have you seen in your line of work that really highlight what you're talking about, Maureen? I'll start with you because you say on paper it's great, but in practice, what do you see?
Well, we see that, you can see that the policies and procedures are there, but the psychosocial safety climate can be quite poor. Is that what you mean?
Yeah, and how does that play out? Have you got a case study you could share?
Oh, many case studies.
Fire away. We're here for it. I'm settling in.
Just picking up on that one, Maureen, I would say one of the most common failings that we see as the regulator in relation to a safe system of work is the failure to implement it and the failure to take action. You can have a system that allows people to advise the workplace of a psychosocial or indeed a physical hazard. But if you do not act when you receive that information, the system will fail. So it's about the implementation, the action. It's also about ensuring that everyone in the agency is on the same page when it comes to safety, so that they understand safety is a priority. I've had discussions with people about, well, how do we do that? Well, we don't know what to do, or we don't. When in a business, if we need advice on finances, we will get a financial consultant. If we need legal advice, we'll go and see a lawyer. If we need insurance, we go and see a broker.
Yeah.
But what are we doing when we need assistance to fix our safety in our workplace? And in most instances, people are relying on what they have internally. And that's because we're not prioritising safety as important for our agency. And so there are a whole lot of elements of why a safe system will fail.
Because the knock-on effects of getting it wrong, of not doing it properly,
my
are
gosh.
enormous, as you say, from not just a monetary or productivity.
Oh, thank goodness.
But physical.
Absolutely.
And the knock-on effects across families, relationships, life is enormous.
Yeah, it's really terrible. I've been involved in some litigation cases lately as an expert witness, and yeah, here we are with some people that are, really, really severely damaged, and you can just see a whole litany of system failures that have led to this. And, you could imagine if somebody actually enters something into the risk register and nothing happens. I mean, you can just see that this is going to end up as a, very clear legal negligence situation.
We've spoken about that in another podcast around the legality and...
that was with the independent prosecutor from Queensland.
And that was a fascinating conversation of how the legal fraternity is still really learning how to navigate psychosocial claims.
Yeah, but they are, and I think the legal system can easily handle traumatic exposures. So if you're a police officer, nurse, teacher that exposed to a traumatic experience, I think that gets through these systems a lot better, like the workers' compensation system and other legal processes, a lot better than, exposure, chronic exposure to a poor psychosocial safety climate or, high job demands, low control, lack of support, all these things. So there's a long way to go, I think, in recognising, chronic exposures, not just like acute nasty things, but just the erosion over time of
those compound psychological injuries.
Yeah, definitely.
So if you're in a workplace, for instance, that has a high level of workplace violence and aggression, and you're exposed to that day in and day out, over time, it could result in a psychological injury. And that's what we're trying to prevent when we're implementing risk management systems for psychosocial hazards.
Yeah. There's an example from, I hope they don't mind me saying this, the South Australian Ambulance Service, in the call centre where, the people answer the 000 calls. And, of course, there's, a lot of traumatic exposure there. And so they've made a decision, and people kind of sign up to this, that, if you're exposed to X amount, then somebody actually contacts you to see how you're going. It's a proactive thing. You don't have to wait till you're breaking and go to an EAP or something. They're actually sort of proactive, like how you're coping, do we need to shift something around? What do we need to do? So it's like, as I discussed, it's like the organisation having some humanity going, this is any normal human in this situation is going to feel a lot of stress, and how can we help these amazing people keep going or actually, move into another situation And
it helps from feedback from the staff, the employees. Does it work?
Yeah. I'm not sure exactly of the efficacy, but from my own understanding about how things ought to work, I think that's a really great idea.
Because you said, Jacqui, talking to staff and working out what has actually worked on the ground. What are you hearing?
So as a PCBU, and I have, almost 100 staff, So I can do it. If you are in a larger agency, there might be a few people taking this role. We use the Eco Portal system to report safety hazards. If one of my people put in an Eco Portal, I will go and speak to them and ask them if everything's being done. Are they satisfied that we're addressing the hazard, and is there anything else that they need? That goes a long way, because one of the issues that we hear and this whole idea of we put in a report and nothing happens, so why bother putting in a report? That is real. And whether it's perception by the person that nothing's happened, whether it's a communication breakdown, whatever it might be, when the people in leadership go and speak to their workers and say, I know you've put this in, thank you for submitting that, you've raised a really important issue in our organisation, and now we're going to address it, and if it's not addressed, please let me know, the person feels vindicated. They're actually, and as a PCBU, I'm so grateful, because I don't know what's going on all the time and what hazards people are exposed to. So when somebody brings it to my attention, I am grateful.
Yeah, you should be best practice, because you are WorkSafe ACT. I know I've got lots of other questions here, but from practical interventions, from being approachable to putting in those that risk into the system for logging it, either anonymously or putting your name to it, all of these things play into it. There's clearly a regulatory and a legislative landscape here that employers have to adhere to. Does that play into it as well, protecting yourselves as well as the worker?
It doesn't for me. And I know that, the legislative framework's fantastic, and yes, we have obligations. But for me, first and foremost, it's about ensuring that when my people come to work, they're happy and healthy and they're safe, and they're coming to a workplace where they want to be, and I'm in a workplace where I want to be, because, there's nothing worse than waking up in the morning and thinking, work again. And I've certainly worked in places like that where I just don't want to come to work. But for us as the work health and safety regulator, when we're going out into workplaces and assessing whether or not people are managing their risks according to the work health and safety legislation, I want my people to be able to do that knowing that they themselves are in a workplace that prioritises their safety.
Is the driver the legislation for a lot of employers, or care?
Yeah, no, it's a very, very interesting question. Actually, across European countries, in a big survey called the ESNA surveys, the European Survey for New and Emerging Risks, they asked the most senior work health and safety person in their enterprise what was the most important factor driving their approach to managing psychosocial risks at work, and it was the regulations. And then I think sickness, absence, these other kinds of things, but it was the regulation. And we've just published something right now which is evaluating the impact of the regulations in Australia. And we can see that in jurisdictions that have implemented these new regulations, that the psychosocial safety climate is higher than in jurisdictions that haven't yet implemented the new regulations. But even more than that, we've also done some research across the globe, as far as we could, where we asked experts from each different country about the regulations. We also have got information about union density, for example. Union density is also very important for organisational PSC, psychosocial safety climate, and regulations are important over and above union density. So they're both important, actually. We've seen, these are 3 or 4 studies that show this kind of effect. So I think that, employers need a bit of a push, and the regulations have provided that stimulus. And you asked about, what do people think about the word psychosocial? You can track the word in the academic literature. We asked the librarians to have a look, when did it emerge, psychosocial safety? And we got them to start at 2000, and then it started to emerge in 2007, and it's just going up like this. And if you have a look on LinkedIn or something like this, you can see all of these like consultants, everyone's talking about psychosocial safety. So it's a word that I think, people are beginning to understand. I really love it because it's making people think more about the psychosocial situation, taking them a little bit further up from the actual psychological health. That's important, but let's look at this, if we've got the safety here in managing the psychosocial risks, this will create a psychological safe environment. So psychosocial safety is the pinnacle, I think.
And it's such getting it right will have such an impact on our community and our society.
How do you mean? What in what way?
Well, the trickle effect of a psychological injury that's caused by a workplace is ongoing in our community. There are massive implications for the person and their family, friends, loved ones. There are implications for our health system. Some people who end up having a psychological injury caused by the workplace will end up homeless, will never get back to the workplace. So if we tracked that, we would see this human impact that is incredibly massive. And the fact is, people don't live to work. They work to live. And as an employer, what we should be doing is ensuring that their workplace is safe so that when they go into the community, they're also having a positive impact on our community rather than a negative one. And we often talk about costs when it comes to employers, but in speaking with PCBUs who have had injuries in their workplace, have never ever heard one say that this is what they've wanted. In fact, what I have heard them say is, I never thought this would happen to me in my workplace.
Business is business, though, and business is there to drive the economy, to make money, to employ people, yes, but also to get stuff done. And sometimes businesses aren't always caring, nurturing places. They are there to get a job done. Employees are there to do that job. Where's the line between reasonable management if you're managing someone to get a job done and they're not doing that job? How do you incorporate psychosocial risk management practices and good, decent management in there?
I think this is a really interesting subject. And the reason I think it's interesting when we talk about business and psychosocial safety is because we know in the retail industry, for instance, there will always be a percentage allowance for shoplifting. And people accept that as a normal part of business. But when we're talking about psychosocial safety, we don't accept there will be some loss of productivity because there's a hazard in the workplace. And I have had to make those decisions. When, for instance, last year in our workplace, we had a couple of people come to work and they were COVID positive. And so we were notified straight away by the person, and it was just before Christmas. And people were getting ready. I think it was about 2 weeks before Christmas. And, people were looking forward to having the holidays with their family. And so my immediate thought was, I know all of my people want to have a really nice period with their family over the holidays. How do I protect them now so that people don't walk away from our organisation with COVID over that period? And so we shut down all proactive visits. We sent everyone home. And what we did is we kept responding when we needed to conduct a reactive visit. But we changed how our workplace was working so that people could do that from their homes. So our inspectors could leave their homes and go out to those visits. Now, During that period, we did see a decrease in our workplace visit numbers, but I knew that was going to happen and I accepted that as part of my normal business operations. For some reason, when it comes to safety, people blame at times the individual rather than understanding this is created by the workplace. And so we have an obligation, not just the legal one, but we have an obligation to ensure that we do something about this.
Maureen, you work with lots of businesses.
Yeah, well, I was just going to say, I think that, if it's a question of someone's poor performance, there's ways to manage that legally. There are systems in place. Reasonable management is okay. I always think these situations are pretty tricky, and I know that performance management is one of the key drivers of bullying in the workplace or accusations. And so I think, going in pairs into these kind of situations is a good idea so that there can be witnesses to the process. If somebody's exposed to a psychosocial hazard and can't perform very well, that's covered under the Work Health and Safety Act. You can't expect to work under those kind of conditions.
Can I just pick up very quickly on the performance management thing? Performance management is a reasonable management action, and because it's considered to be reasonable management action, it's covered as an exclusion under workers' compensation laws. But performance management should never be about getting rid of someone. Performance management should be about getting that person to where they need to be to continue doing their job. If we approach performance management from that perspective, it should never be bullying, because what we're actually doing is working with that employee to bring them up to where they need to be so that they are contributing equally in the workplace.
I do think that, these kinds of aggressive actions from management to workers can occur in our kind of economy. We have a capitalistic economy which is, based on profits and productivity, and some organisations have to turn a profit or, make ends meet. But they also have, shareholders that want, an increase in profits. So you start to forget about the workers' needs and focus on everybody else's needs. And this is a real danger, I think. So it's a question for society. What sort of jobs do we have on offer?
And in performance management, Jacqui, you said about performance management and getting the human to do their job better. What if the actual human is the one causing the psychological harm in that workplace?
I've had that situation in my in workplaces that I've been in, and the most important thing to do is to use that risk management process. So if we have had reports of, say, bullying, and we're assessing that bullying and we're trying to risk manage what's going on, the first thing that we will do is we will conduct a risk assessment. And as part of that risk assessment, we will look at what controls do we need to put in place to prevent, if it's between, say, two people, to prevent the contact between those two people while we are sorting out this situation. So that's one of the first things that we'll do in that instance.
What about a broader workplace culture issue that's just sort of part of that workplace? It's just sort of ingrained into every bit of the fabric.
Yeah, exactly. We call that institutionalised bullying. It's just part of what they do.
How does that fit into this?
Well, this kind of thing has got to be stopped, doesn't it? It's got to be taken care of by institutions like WorkSafe ACT, where the risks don't have to only be reported to the organisation, but can be reported directly to WorkSafe, right? So, instances of bullying you can become alert to them. Your inspectors can go in and issue a notice. Things have to be improved. Like some of these organisations are going to take time because it's so embedded in the culture. Hyper-masculine cultures in some of Australia's workplaces would be fundamental in this, I would say.
And we know cultural change takes a really long time. And so you need to make it very clear that this conduct is unacceptable in our workplace, and that this is what we're going to do to address that conduct. And sometimes you have to make some really difficult decisions. But the other thing that we've done with our workforce is we've trained them on what is bullying. Because sometimes as an employer, we need to have difficult conversations with our employees, and those difficult conversations can be perceived as bullying, but maybe are not. And so some of the work that we've done at WorkSafe is to really unpick the different things that make up bullying and the different things that make up reasonable management action. And we educate our people on those things so that they understand. I mean, it's great in the sense that we're the regulator and our people are out regulating those things, so we're training them about them anyway. But it has had that positive impact on our own agency that, you know, people are very clear in their understanding of what is bullying and what isn't bullying.
People in positions with a high public profile, that's why you paid the big bucks to deal with a lot of scrutiny. Where does the psychosocial risks play into that?
I think it's interesting with the media, and you know, it's bullying, right? You know, they also have a code of ethics, and you know, you would think that under journalism ethics that one shouldn't go below a certain line. That's just my initial thought. I think people in high-profile positions, it does come with the job somewhat, and there should be, you know, some sort of like, you know, preparation for it and some kind of social support to manage it. So it's, you know, we can sort of share the load. We know how to respond to this person. I mean, you know, look, if this person is behaving like this, everyone else can see that they're behaving like this, and you can call it out as well. On
a more general level, for people who are under intense public scrutiny, and the pile-on that happens from the media, from social media,
absolutely,
and without necessarily the full story there. They're paid big bucks to do their job, and hopefully they've got the training and the resilience to be able to deal with that. But they're only human as well.
Yeah, I want to turn that on its head for a minute and just say people don't get paid to be injured at work. People get paid for their skill, and people are paid for their decision-making ability and their ability to, if they're in a high profile, to run an organisation. But I'd like to use an example. I was at a meeting about 12 months ago, and we see this, for instance, in the law industry, where their bills are calculated in 6-minute blocks. So for every 6 minutes, they are paid, you know, if you're on $600 an hour, for instance, and you're a lawyer, 6 minutes works out to $100 an hour. And so I had a lawyer ask me the question, is there any recognition in the legislation that lawyers, for instance, are paid to work long hours? And I was quite shocked, because I know junior lawyers at times, and I was one, are working extremely long hours. My view on that is those junior lawyers and other lawyers, they're not paid to work long hours. They're paid the amount that they are paid because they have studied at university and they have a particular skill to offer the organisation. So we need to get away from this thinking of this is just part of the job. Because that's essentially what we're saying when we are saying that, you know, aren't you being paid to put up with that? You're not. You're never, ever being paid enough money to walk away with an injury.
Same with junior doctors, you know.
Yeah.
Does it come down to training then, as you go up through the ranks to higher management to be able to navigate this? Does it come down to...
It's in the design. It's in the design of the work.
And a culture.
And the culture.
Certain sectors have risks, psychosocial risks that are unique to them.
Well, I guess they're sort of unique, but they don't have to be. You know, like they are culturally derived and they've been there forever, like young doctors have to work like ridiculous hours, stupid shifts, because that's what their seniors once had to do, this kind of thing. We need to shake things up and just make sure that people are safe. They're not safe. They're constantly striking and saying, like, we're really suffering here. We need to turn our attention to them.
And when does that psychological risk become then a risk for the people that they are serving?
Exactly. Yeah, exactly.
Yeah, and it's that classic example of, the universal language that when we get on an aeroplane and the mask drops and everybody around the world understands that if you do not put your mask on first, you cannot help anyone else breathe, the people next to you, either the children or elderly. And so if we think about that analogy when it comes to safety, it's around, and in the people services industries in particular, it's how do I provide a service to somebody else if I can't breathe, and I absolutely can't.
It's a great analogy.
I want to just bring up when, as humans, we bring our full selves to work, and sometimes that can be mental health issues. What's the line for the PCBU to address someone's personal mental health issues versus the workplace psychosocial safety?
So if people have mental health in not related to workplace, then it comes under HR and the Discrimination Act, because you cannot discriminate against somebody because they have an injury or illness. And what the employer needs to be doing is looking at reasonable adjustments in line with the Discrimination Act. That doesn't come under the Work Health and Safety Act, but it's not that black and white always, because there can be some crossover where a person has mental health and then they bring that mental health into the workplace, but then there's a hazard in the workplace that exacerbates their mental health. And so we may have to do both things, but if we're always addressing the psychosocial hazards in the workplace, then that automatically is happening. Then we are addressing the mental health through our reasonable adjustment system.
It's such a relief when somebody that you work with tells you about what their health circumstances are, their mental health circumstances, and it kind of explains everything. Like you might be thinking, this person's kind of slacking off or something, what's going on? You can't really put your finger on it. And then they tell you that they've been having panic attacks or they've got anxiety or, something's going on. So if there could be this like comfort relationship between employees and managers, to be open about what the worker needs are and how they can, be assisted to meet those, like come to work a bit later, leave a bit earlier, work in the morning when your mind is like fresh, like there are, the worker will have a lot of strategies already in place in their head about how they can actually do things. And I would encourage them to get some advice from their psychologist or something like this to help inform what we should do, how we can cope.
That's fantastic. Again, probably in theory, because we've got workers who are from migrant, disadvantaged backgrounds, vulnerable workers, people who really need to go to work for the money and bring home that wage.
And if you have a supportive workplace, people will speak to their supervisors about what's going on. And if it's collegial in the workplace, they'll also speak to their colleagues. And so the team will work to ensure that there's a wraparound for this person.
Maureen, you're the director of the Psychosocial Safety Climate Global Observatory. You've looked at this, you've done research on it, you've ranked businesses according to how safe they are.
Yeah.
What do you see? Are we doing well?
62% of Australian workers say that they are in a high PSC context. So that leaves the rest.
PSC context meaning?
Meaning a high PSC context. Like they do have top management support, all the things that I mentioned before. So they are in a very, very safe context. And of course, there's like 40% that, goes down to about 11% or so in a very high risk. We've done some research. So we had a sample of Australian workers and we took out everybody that had symptoms of depression And we followed them over the next 12 months. And those workers that were in a very low PSC context had 3 times the risk of depression within that 12 months, 3 times higher than all the other workers. So it's just so important to consider the psychosocial safety climate in this. And just on the terms of cost, if I could just mention a little bit more research and the workers' compensation. I mean, we know that there's a correlation between a poor psychosocial safety climate and future psychological distress and depression. We can see it in self-reports about workers' compensation. But again, with this big data set, we asked people about their working context. We asked them which organisation they worked for, and then we married up those organisations with the workers' compensation data. And we found that those workers that were in a low PSC context took, almost twice as long to get back to work. And the expenditure was, at least twice as much as workers that were in a high PSC context. So even after you go off work on workers' compensation, the prognosis is much better if you are going to go back to a high PSC context. Just a few more examples because it's about EAPs and the limitations of EAPs. I mean, it's just so convenient to say we've got an EAP, so we've got mental health of our workers under control. But our research shows that if you go to an EAP and we assess the PSC beforehand and we also measure their psychological distress beforehand, in a fairly short period of time, their levels of distress actually reduce, and so that looks really good. But they are much, much better if a worker is going to go back to a high PSC context. So the efficacy of an EAP is really dependent on going back to a high PSC context. So I've got a bit of a beef about the disconnect between sending someone to an EAP and all the information and learnings that could come from that information being in the organisation, how to look at the system to help that worker, not sort of send them out there for, an external sort of treatment. And just one other thing on the issue of the impact of, these work environments in society. We can see a correlation between workers' low PSC and antidepressant use, for example. So here we love data linkage by the sounds of it, but we linked up the Australian Workplace Barometer data to the PBS data. And we could see that, the expenditure on antidepressants, for example, was really huge. And so then you can sort of translate that to, what does it mean at a population level? We estimate that, at least $17 million are spent on antidepressants that could be prevented if people moved from a low PSC context to a high PSC context.
Wow.
So this is, people are paying, for their own, like their insurer might be paying for their medication or the government's paying. So this is a really interesting translation of work problems into the workers' compensation system, into, the public health system.
I've got so many more questions. I feel we've hardly even touched the size of trying to navigate this. There are so many aspects to it.
And when we talk about that trickle effect, that sort of data is extraordinary.
Yeah. It's, there's so much information for organisations to understand that if they actually improved their safety system, their productivity, should go up because people won't be off work, they won't be turning over and they won't be going on workers' compensation.
And they'll be happy. But it comes down to culture and changing this ingrained culture that's there so often and managed. Jacqui, I just want to ask, how often do people claim workers' compensation for psychosocial harm?
Yeah, so there's some interesting data about that. So that the workers' compensation data lags. That we know in the financial year 2022 to 2023, throughout Australia, there were 13,866 psychosocial workers' compensation claims approved. And that represented approximately 10% of all serious claims in Australia. And females accounted for 59% of those claims. So we do know, for instance, that because the people services industries are traditionally female, and we're seeing a lot of claims in those sorts of spaces because we're not addressing the hazards associated with workplace violence and aggression well enough. But in the ACT, in the same period, there were 169 psychosocial workers' compensation claims, and that again represented 10%. But if we nut that down and look at, say, education and training, in Australia, the same period, 22 to 23, there were 2,181 claims, but in the ACT, there were 40 claims. In the ACT, 40 claims made up 24% of our serious claims, whereas overall in Australia it was 20%. So what that tells me is we need to do better in the ACT in that space, but the same in the health and social assistance industry. Overall in Australia, we saw 3,315 claims, which accounted for 13%, and in the ACT we saw 41 claims accepted for psychosocial claims.
I think we've only just touched the sides.
Oh, it's such a big topic, isn't it? We could talk about this for 3 days and still be unpicking it.
Well, I'm very happy about the new regulations. I think Australia is actually leading the way in this in the world at the moment. We should be really proud about that, the work of all the stakeholders in bringing that to bear. I think that psychosocial safety climate can be assessed. So in the regulations, it says, you need to assess all these risks, but I think the most fundamental risk is having a poor psychosocial safety climate. And we've got all this evidence that it can be assessed reliably and validly and could be part of the regulations. I also think that it can be a KPI for management, like that they should return a good psychosocial safety climate, because that's the thing that workers can see the whole thing, the whole gestalt, and provide information upwards about how things are. So I think they are my two. And trying to mobilise the HSRs is a really valuable resource. They really want to do, they're highly motivated in this area, but probably not that well coordinated and used, and could be an amazing resource. So I hope that they are fully supported in the work health and safety system.
And I want to address this question from a PCBU and my own experience. And firstly, what I would say is absolutely make clear your expectations in your workplace and just start, but understand this isn't a quick fix. This takes time. It's taken us 5 years to get the results that we have, but I know that work health and safety cannot be and is never set and forget. So continually review and make continual improvements.
Never finished.
Yep.
Thank you both so much for all your expertise and thanks for listening. If people want to find out more information, whether they're an employer setting up the processes, making sure their workplace is safe, or a worker that feels that they have an unsafe workplace,
go to the Code of Practice. The Code of Practice for employers is the textbook of psychosocial hazards in workplaces.
Is there a place that you love to send people to, Maureen?
They can come to us. We've done a lot of assessments in organisations, for example, a report helping them understand psychosocial safety climate and all the other risks, and also workers and unions, do a lot of work with unions. Happy to talk.
Thanks so much for listening. My name's Lish Fejer. Thanks to my fabulous guests, Maureen Dollard and Jacqueline Agius. If you've loved this podcast, give it a like, share it around and subscribe. Thanks for listening.
And listen to the others.
If this is your first foray into Safety Spotlight, go and listen back to the others. There's so many different aspects of workplace health and safety to explore. We're getting through them. Thanks for listening.